Some universities will directly say, tell us about the work experience, while others, you might have to integrate that into other questions that they're asking you. If you're asked directly, then start by telling the interviewer exactly where, how long, and what you were doing. Whenever you undertake any work experience, it's good practice to reflect on it and think about any learning points. Work experience does not always need to be in a hospital setting, so even if you've done work experience in other environments, then think about what you've learned from that and what you'll take forward with you. Whenever discussing work experience that you've done, try using this simple structure. Explain where the work experience took place and what you did during it. Think about who did you shadow, how many days was the work experience, was there a particular reason that you chose to do that work experience? Did you have an interest in that area, or what inspired you to do it? What did you learn from the work experience, and what did you observe? The interviewer does not expect you to learn about complex medical conditions, so instead focus on the other things that you've learned. How was the communication between different healthcare professionals? How did the person shadowing interact with their colleagues? How did they interact with their patients? How did they interact with you? Think about if there were any aspects that you found challenging. Did you get a feel for what it's like in the day-to-day role of the person you were shadowing? What did you like most? What did you dislike most about it? What did you observe that you can learn from and apply to your own life when you're a medical student? Make sure that you reread your personal statement. Any work experience that you've mentioned can be asked about, so be prepared to answer any questions on this. Okay, when it comes to work experience, often the interviewer will be more interested to know what you've gained from the work experience rather than what you've actually done. The best answers usually come when a candidate has reflected on what they saw during their work experience and how they'll use that going forward. Because of this, they won't always ask directly, what work experience do you have? But instead will ask questions such as, tell me about a stressful situation. And then you can answer the question while integrating an anecdote from the work experience that you've done. We recommend that you create a diary to record what you've done for any work experience. If you've already done so, then great, but if not, you can start now. Try to remember what you've done on each individual day, who you spent time with, what did you observe, were there any challenges that you faced. You should also be prepared to use anecdotes from your work experience when asked other questions. For example, why medicine? You might reflect on something that you witnessed during your work experience that's inspired you to study medicine. Was there somebody who showed empathy towards a patient or a colleague? What did you observe in a well-integrated multidisciplinary team? These are some questions where you might have to have an anecdote prepared. This will allow you to talk about your work experience without being asked about it directly.